and international public servants in calling on the G20 to immediately commit additional financial resources to fill the most urgent gaps in the COVID-19 response. In a letter to the G20 group, calls on the world's richest nations for $200 billion in additional financing to supplement actions of international financial institutions. The letter calls for $1 billion to be allocated to the World Health Organization to enable it to properly carry out its mandate, $10 billion for vaccines and their distribution for the world's poorest countries, and $2 billion for therapeutic treatment while vaccines are being developed. It further calls on the international community to waive this year's debt of repayments for poorer countries, including the $44 billion due from African nations. Well, for more on this, we are now joined by SABC's Foreign Editor, Sophie Mokoena, who now joins us. Good evening and welcome to The Full View. Starting off with this response in terms of the letter that has been sent to the G20, this has been an ongoing call that we've heard even from the African Union as well, that the debt owed by African states must be waived, especially during this period.
Yes, indeed, Aldrin. You know that a week ago, the President of South Africa, who is currently the chair of the AU, gave an indication that during his meeting, the teleconference meeting or the virtual meeting with the G20 member countries, he made an appeal on behalf of the continent that the continent needs support, particularly vulnerable countries around the world. And this message augurs well based on what the head of the AU currently, that is Cyril Ramaphosa, was called to ensure that there is help, but also to ensure that those countries that have got debts to settle, they are not being forced to pay those debts at the moment where they are dealing with this coronavirus. But also we know that yesterday there was a meeting of Council of Ministers of the AU chaired by Dr. Naledi Pandor. As you are aware that she is currently a chair of the Council of Ministers for AU, where they discussed the range of issues. Let's look at what were the issues discussed. The first thing that was on the table was around the issue of funding. You know that the heads of state 2 weeks ago made an announcement that they have established a fund that is called Coronavirus Fund. And this fund, it's going to help countries that are battling the virus, but also to ensure that they allocate certain portion of this money to the CDC in Addis Ababa, where they can continue with research, but also to help share information among member countries. The fund will also be used by regional bodies where they have established corona centers in different regions, where they are pulling together the resources to try and fight this pandemic. The other issue that was discussed was a call to regional agencies. For example, the African Development Bank has already made a commitment to put aside $10 billion to assist member countries, but also a call to private sectors to help member countries in their respective countries. The CDC Center also in Addis, they were able to present a report sharing information in terms of the spread of the virus and what the CDC is doing to assist the member countries. The other issue that they talked about was the support for the World Health Organization. You know that the director of the World Health Organization, Dr. Tedros, has come under fire, particularly from countries such as the United States of America and certain European countries, where he's been accused of supporting China and agreeing, or perhaps didn't call out China when China didn't give proper information in connection with the spread of this virus. And therefore, the African countries sending a strong message that they support the current director and he's doing a good job, but not only the African countries. This morning we saw a statement from the non-aligned movement. These are 120 countries that are supporting the director currently, and this has actually assisted him to be bold in terms of addressing the media today and talking about what needs to be done going forward.
And all of these developments are taking place as we know that the United States of America has said, for instance, that they want to withhold funding from the WHO. And here we have this letter that was the letter that was sent to the G20 countries, and being quite specific around the amount that should be contributed in addition to what the WHO is currently getting, saying that there should be an additional 1 billion rand amount. And looking at how silent some blocks have been over the WHO's Director General, what does this mean in terms of trying to mobilize funding for the WHO?
It is going to be a difficult one because countries have similar challenges. All the countries around the world are trying to come to terms with the reality of the coronavirus, and some are going to use this as an excuse. But we know that the Secretary General of the United Nations, Antonio Guterres, has also made an appeal to member countries to continue to support the World Health Organization. We know that after Donald Trump made comments that he is going to stop funding the World Health Organization, he has since denied that he made those utterances. So we are hoping that America will continue to assist the World Health Organization. But I think other member countries as well, the developed nations, particularly the G7, will have to continue to assist the World Health Organization. I also suspect that because the director has come under fire from countries that are fighting with China. China might come to the party and ensure that he gets the funding that he needs. And also China will have to pull all stops to ensure that based on their experience and their capacity, they do assist the world to deal with this pandemic.
In closing, let's quickly touch on what's happening in our neighboring country, that is Botswana. Number of MPs under quarantine.
Yes, you know very well that the President of Botswana, Mokgweetsi Masisi, convened Parliament on Thursday, on Wednesday, where he wanted Parliament to approve his proposal for the state of emergency. But unfortunately, apparently, when the members of Parliament were entering the precinct, they had to go through screening. And during that screening, apparently one of the health officials who was doing the screening is the person who later was classified as a person who has tested positive for coronavirus. And therefore, there's fear that based on contact, members of Parliament, some of them might have been vulnerable at that moment. And therefore, the Director of Health in that country took a decision to quarantine the entire Parliament, members of Parliament, including the President of that country, Mokgweetsi Masisi. We are aware that this will be the second time President Masisi is now under quarantine. You'd recall when he went to Namibia during the inauguration of the Namibian President, Hage. Upon return, the Director General took a decision that he must go on quarantine for 14 days. Therefore, members of Parliament and the President are now under quarantine. Today will be perhaps the second day, but we are told that yesterday the Director General had to take measures or serious measures. Some of these members of Parliament, after Parliament meeting, they went to shopping malls and interacted with people. Unfortunately, the ordinary citizens took pictures and videos, and the videos went viral that these people have been told to go straight home and self-quarantine, but unfortunately they are interacting in Botswana. And therefore, the Director General again taking a strong measure to ensure that they do comply with quarantine. And therefore, it's a difficult one. But we'll see after 14 days what's likely to happen.
Extraordinary times that we live in. Thank you so much, Sophie Mokoena, SABC News' foreign editor. And let's move over to this story. The United Nations